Hi, I am Dr. Saravana Rajamanickam. I am a lung cancer surgeon specializing in the treatment of lung cancer patients. Lung surgery, especially for cancer, is a very complex operation. In open surgery, what we do, we use our hands. You can see our hands are so big and they have to enter into the chest. To enter into the chest, we have to make at least a 20 centimeter cut in the chest, which is one of the most painful operations that a human can undergo. And once you go inside, you have to maneuver the lungs using your hands and you do surgery. So when you do open surgery, it's very easy for a surgeon, but it's extremely difficult for the patient. Now, what is robotics? Robotics, the instruments of the robotic surgery are almost the same size of the pulp of my finger. And they are so precise, they cut so precisely. Any tremor, suppose if I had tremor, what tremor I have will never be translated into the robot because the robot filters the tremors, and an old surgeon probably will have an advantageous time because their tremored hands will be totally dampened by the robotic technology. Another thing that we are seeing now is, whenever we used to do open surgery, it was difficult for us to do small operations because it was deep inside. But now when you do with robotic surgery, the entire operation is as if I am operating from inside the chest. And you can do nuanced things like anastomosis, suturing, all these things with utmost dexterity when you use a robot. Robotics is extremely useful when we are doing segmental resections because when we do segmental resections, there is no way in which we can identify the division between the internal segments. So we have a technology called indocyanine green or firefly in the robot. When you give a particular drug and when you switch on that, the entire lung that needs to be removed will become dark and the entire lung that needs to be preserved will become green in color. So it's a absolutely wonderful tool for us, especially when we are performing complex surgeries like segmentectomy or sleeve resection.